want to share with you 5 important things that you should know about a colonoscopy. Number 1, a colonoscopy can save your life. During a colonoscopy, if any polyps are found, then they are removed and then sent to the lab to find out if they were precancerous or benign. A polyp is a growth that forms on the lining of your intestine. Colon cancer starts as a polyp, so if you find it early enough, then it can simply be removed during your colonoscopy instead of having the chance to grow into a large, dangerous tumor. Number 2, you are personally at risk of getting colon cancer. Yes, you. If you live in the United States, then congratulations. Colon cancer is a leading cause of cancer-related deaths for men and women. Number 3, the number 1 risk factor for colon cancer is age. For most people, that's starting around age 50. So get a colonoscopy based on your birthday, unless you have additional risk factors, which brings us to number 4. If you have additional risk factors, then you should get a colonoscopy prior to age 50, such as at age 45 or even 40. Minority groups, especially African Americans, are at high risk. According to the American Cancer Society, African Americans have the highest incidence of colon cancer. Other risk factors include family history of colon cancer, those that are overweight or obese, smokers, those that eat a poor diet, don't exercise, or frequent alcohol use. And number 5, you should get a colonoscopy before you have symptoms. If you wait until you have abdominal pain, weight loss, changes in your bowel habits, or blood in your stools, then it's probably too late to cure any bowel problems easily. The worst part about a colonoscopy is the prep. But in order to have a successful procedure, your colon must be clean so that your doctor can find and remove any hidden polyps. So plan to stay home the day before the procedure and don't cheat on the pre-op regimen. Most people are given medication during the actual exam that makes them completely comfortable and unaware of the procedure. It's over before you know it, and you'll be glad you had it done. Now, I want you to meet someone that's had to face advanced colon cancer before even turning age 50.
So for me, it started with a little stomach pain that came and went a couple seconds at a time, maybe over a 2-year period. Like most guys, I just ignored it. And then one day the pain wouldn't go away. So I ended up at the emergency room that day, and every test they ran on me came back negative. The doctor came into the room and said he wished that he had my test results. He suggested that maybe I should get a colonoscopy. At the time I was 48, and considering that my mother had colon cancer 10 years prior, I thought it was a good idea. So about 2 weeks later, 3 weeks later, I had a colonoscopy done, and when the doctor came in the bay after it was over, he didn't mince any words. He said, "You have cancer." In fact, he said the tumor was so large he couldn't get the instrument passed to continue the examination. By luck, a surgeon had an office appointment available that day, and I went and saw him, and we had a colon surgery scheduled a couple of weeks later. They took out 9 inches of colon that day. And after the recovery is done, you find out what type of cancer it was. In my case, it was stage 3C. And there's only one worse, and that's 4. And for a lot of people, the first sign of cancer of that stage is death. If you look at the tables on the internet, it gives me a 47% chance of survival. But to keep the odds as high as possible, I went and did chemotherapy. The end result of the chemotherapy is hopefully a better chance of survival. It also resulted in peripheral neuropathy, my hands and feet. I lost feeling in them. And the experience was not great. I don't recommend chemotherapy, you know, if you're thrill-seeking. Jumping out of an airplane, bungee jumping, something like that. But it had to be done. And the sad part is it had to be done because I didn't go in 10 years earlier when my mother was diagnosed with colon cancer. It would have saved me a lot of grief, a lot of pain, and all the people around me. It would have saved a lot of grief and pain because they suffer too. And even though you had to go through all that, chances of survival right now are good. But if I didn't get a colonoscopy, if I didn't take the time to go in because of a little pain, the results would have been a lot different.
Like two straight